As we wait to hear from the President at 8 o'clock tonight, let's get an international perspective on second wave restrictions, what works and what doesn't. I'm joined now by our Washington correspondent Simon Marks and our London correspondent Olly Barratt. Good evening to both of you. Olly, I'm going to start with you. We heard about a series of these so-called postcode lockdowns in the UK, which didn't seem to work, and then we heard about entire cities locking down. Just talk to us about the second wave restriction plan and what worked, what didn't work.
Well, we're actually, Sally, now in our second phase of tiered local regional lockdowns. We had a similar system in place before the national lockdown, which ended on December the 2nd, but the government has now admitted that that first tiering phase leading into national lockdown didn't work in the way that it wanted it to, and that was part of the reason that we did end up in a second national lockdown. And after the national lockdown, we've moved into these tweaked, toughened tier restrictions. So in the very highest tier, for example, pubs and restaurants can't reopen for anything other than takeaway food. Pretty stringent restrictions now in that top tier, but that has also opened up that argument about which area should be in which tier and exactly why and based on what data. You have some areas which are right next to regions and localities just next door in completely different tiers, with locals up in arms about why they're in a higher tier than people just over the road from them. You have MPs representing constituencies saying that the data they don't believe justifies their area being in the highest levels of restrictions. So it is certainly messy, it is difficult. The government insists that this is the best way to come out of national lockdown and to avoid a third national lockdown.
Sure, so it's certainly not a linear process by any means. Simon, to bring you in here, obviously the United States, astronomical figures, and I think that it's less of a second wave and just one massive tsunami that's just got bigger and bigger. Are there lessons to learn from the way the USA has handled it, or is it more of a cautionary tale?
Well, I think there are definitely lessons to be learned, Sally. I mean, first of all, one of the weaknesses here is constitutional. It falls to the individual 50 states to determine what kind of restrictions to implement. There's been no national policy set, but that's also partly because of a complete failure of national leadership. We have heard today that yesterday the United States recorded more than 2,700 deaths, a one-day record from COVID-19. More than 203,000 cases of new infection, a one-day record. And as of last night, there were more than 100,000 people in hospital all over the United States as a result of contracting COVID-19, also a record. And yet from that building behind me, the White House, absolute silence. Nothing from the President of the United States, who, as you know, has struggled over the last several months to take COVID-19 seriously, even after he himself contracted the virus. So that absence of national leadership, coupled with a determination by many Americans that they're not going to be told what to do. We saw that last week in the Thanksgiving holiday, people travelling when they were told by the Centers for Disease Control and public health officials here to stay home. They didn't believe it. They didn't take the advice. We're now beginning to pay what's going to be a very heavy price for that.
Olly, back to you in the UK. Of course, the news this week that Pfizer-BioNTech vaccines will be injected into probably the elderly, starting as early as Monday. Is that the real game changer here? There's all these appeals to socially distance, wear your mask, even when there's clear political leadership. It seems that ultimately the vaccine is what we all need.
Certainly, and I think we should look to the Prime Minister Boris Johnson in terms of what he believes, in terms of how much this is the way out of all of this and the timeline to it. That's the crucial point here. Boris Johnson saying repeatedly that the cavalry is arriving, the scientists have done it, this is the way out of the social distancing guidelines we're currently under, the tiered restrictions, the repeated national lockdowns. But he is also being very clear to tell the British people, you can't let up yet. even as the vaccines arrive, it's going to take months to roll them out, hopefully more than one, across the population. Even if you take the Pfizer vaccine in Monday here in the UK, you'll need a second shot 21 days after that. You won't be immune, the scientists don't think, fully until a week or so after that. So there is no sense that the vaccination programme beginning next week means that suddenly the British people can relax as of next week, and the government is very, very worried about that. They do worry about the population feeling like they can relax now that the vaccines are starting to arrive. The other point worth making about the vaccines is that rollout is going to be incredibly complicated, and many critics of the government, bearing in mind what they've seen over recent months, are very sceptical that the government can handle it in the way that they say they will be able to. The government insists the NHS is ready and able to roll these vaccines out in a way that can get them into the arms of people as quickly as possible.
And Simon, in the USA, I mean, it's just astronomical, 2,700 deaths in one day. It's just, it's horrific. And we have been warned about the USA that it's going to be another month or two of really, really tough times. Is it going to be a grim Christmas, your side?
Yeah, I think very much so. I mean, the Centres for Disease Control yesterday warned that the next few weeks, all the way through until January, February here, is going to be the most serious public health crisis that this country has ever faced. And Joe Biden, the president-elect, of course, will be taking over right in the middle of a catastrophe that may, by the time he comes into office, have seen the United States record as many as 400,000 deaths as a result of this pandemic. And on that issue of vaccines, Sally, you know, there's huge pressure now on public health institutions here to approve the vaccines for use. But there's also a big debate about who should get them first. And we're seeing in many parts of the country, black community leaders say, look, the African American community is disproportionately impacted by COVID-19. If those community members are not prioritised in terms of vaccine delivery and distribution, you will not be maximising your ability to kind of reduce the impact of the virus on the country, because communities like the black community here, disproportionately impacted by COVID-19, won't necessarily be first in line to get the jab. And that's going to give this virus a much longer tail than it otherwise needs to have in the United States as that vaccine distribution plan is rolled out.
Simon Marks in Washington, Olly Barratt in London, thanks very much to both of you. Such an interesting perspective on the second waves in those respective countries.